Alcohol abuse, basically it is a part of addiction. So if anybody excessive or compulsive use of alcohol, not only alcohol, if anybody excessive use of prescribed medication that can cause addiction, or over-the-counter medication if we use, or even illicit drugs, all of this combinedly called addiction. But here we are going to focus only alcohol addiction. Usually the patient who have the history of alcohol abuse or addiction, usually they have some history or risk factor like family history or recent trauma, familial dysfunction, poor self-esteem, peer pressure, mental health condition, all can influence people to be addicted or alcohol abuse. So alcohol is a central nervous system depressant affecting all body tissues. Physical dependence is a biological need for alcohol to avoid physical withdrawal symptoms, whereas psychological dependence refer to the curbing for subjective effect of alcohol. So when alcohol or any substance abuse, we frequently face some terminology like intoxication. Intoxication means the symptom following excessive use of substance, or tolerance means large amount of a given substance are needed to elicit the desired effect. And also one terminology it's called withdrawal, means physiological symptoms that occur upon discontinuation of substance. It is called withdrawal. So addiction can manifest in behavioral as well, like patient like to gambling, compulsive or sexual abuse or fantasy. So first of all, what are the risk factors? Biological predisposition, cultural, genetics, or familial predispositions may be the risk factor, like family history, recent trauma, familial dysfunction, right? Or depressant or highly in anxious characteristics, low self-esteem, poor self-control, history of maybe you were rich, but now you're poor, or poor school performance, so you addicted to alcohol now, poor parental relationship, children can suffer. What next? Data collection, difficulty of speech, incoordinate movement, unsteady gait, restlessness, confusion. So who are addicted to alcohol, if you go and take the history, you can easily find this kind of problem. They're confused, or drinking in the morning before they go to the wash their face or brushing their teeth, they like to drink alcohol first. Experiencing blackout, bring drinkings, argument about drinking, missing work, increase the tolerance to alcohol. So I said, as I told you, large amount is given substance are needed to elicit the desired effect. Also, the part of data collection should include the type of alcohol, how much you drink, how long, and data, and when last intake or consume. Psychological symptoms like patient undergo depression. When we fall in depression and we want to overcome the depression and we went to the drink alcohol, but indirectly we are falling depression more because dependence develop. Irritable, hostile, suspiciousness always, rationalization, isolation, decrease in inhibitions, decrease in self-esteem, and deny that a problem existence. What are the complications associated with chronic alcohol use? So who intake too much alcohol, they have a chance to develop vitamin B deficiency. They easily get confused and develop peripheral neuropathy. You have a history of alcohol intake and you are confused, sign symptom of peripheral neuropathy, and you can see vitamin deficiency, vitamin particular B1, we call thiamine. All of this together called Korsakoff syndrome. Korsakoff syndrome, a form of dementia. What is dementia? Means a condition characterized by the inability of a person to recall the fact or previous experience, like forgetfulness. Alcohol-induced persistent amnesia disorder causing severe memory problems. Wernicke encephalopathy, it is degenerative condition of the brain and causing confusion, causing ataxia, means impaired coordination, like loss of coordination of voluntary muscle movement. We call ataxia. Also abnormal eye movement. If you take alcohol for a long time, chance to develop hepatitis, and hepatitis lead to cirrhosis, liver full of nodule, and then your liver gets to non-functioning or cirrhosis or carcinoma develop. Esophagitis, gastritis, pancreatitis means inflammation. Also, anemia developed. What else? Complication associated with alcohol, chronic alcohol use, immune system dysfunction, brain damage, peripheral neuropathy, and cardiac disorder. Now, your patient want to stop to intake alcohol. So, addiction or alcohol abuse, first of all, when patient intake alcohol, we call intoxication. Symptoms following excessive use of substance, like example, intoxication sign symptom, difficulty of speech or blurry of speech, unsteady gait, facial flushing, impaired judgment, and motor coordination. What are the alcohol withdrawal symptoms? And what are the nursing care for withdrawal? Let me explain. The early signs develop with a few hours after cessation of alcohol intake. So Imagine I am alcohol addicted. Now, doctor or healthcare provider stop me to intake alcohol. So when I stop, I have developed few of the signs and symptoms because of stopping alcohol. Early signs develop within a few hours after stoppage of alcohol intake. This sign peak after 48 hours and then disappear unless the withdrawal progresses to alcohol withdrawal delirium. So what is delirium? Means a temporary mental state characterized by confusion, anxiety, or incoherent speech. Also, hallucination. At the onset of withdrawal, follow agency protocol using specified withdrawal assessment scale as indicated by unit or agency policy. One of the drugs called chlordiazepoxide may be prescribed for acute alcohol withdrawal and is usually given orally unless a more immediate onset is required, like benzodiazepine would decrease the withdrawal symptom because of cross tolerance. An intramuscular injection of vitamin B1 like thiamine followed by several days of oral administration is usually prescribed to prevent Varnica and cephalopathy. What are the early signs of alcohol withdrawal? Like patient develop anorexia, anxiety, easily startled, restlessness, hyper alertness, hypertension, insomnia, irritability, jerky movement, possible experience of hallucination, illusion, delusion, and nightmares. Hallucination means false sensory perception, right? And experience without any real external stimuli. And they are usually experienced and originated in the outside the world. I said false sensory perception, hallucination. Illusion means misperception of real external stimuli, most likely to occur when general level of sensory stimulation is reduced. Delusion means fixed false belief cannot be corrected by logic or are not consistent with the culture and education of the client. So you have to know what are the difference between hallucination, illusion, and delusion. Possible report of feelings of shaking in sight, seizure, involuntary movement of muscle, tachycardia, and tremor. What next? Next here is hesitation, anorexia, anxiety, delirium, diaphoresis, disorientation, fever, hallucination, delusion, insomnia, and tachycardia and hypertension. So tremor, insomnia, anxiety, GI upset, palpitation, headache, it's more common person who have alcohol withdrawal symptom develop. even sometimes seizure. And you know, the seizure is the priority of management. Withdrawal start within 5 to 10 hours of suggestions of prolonged alcohol use or peak between for 24 to 48 hours. So sometimes NCLEX would ask alcohol withdrawal delirium, which is called delirium tremens, means severe alcohol withdrawal symptom. It is hallucination, tachycardia, hypertension, diaphoresis, and agitation together. So if your patient have this problem, okay, it is called withdrawal delirium. So the state of delirium usually peak 48 to 72 hours after suggestions for reduction of intake. Withdrawal delirium is medical emergencies. Death can occur from myocardial infarction, fat emboli, peripheral vascular collapse, electrolyte imbalance, aspiration pneumonia, or suicide. What are the intervention? What are the treatment? So it is good IV fluid and electrolyte balance. Benzodiazepam is very effective. It is benzodiazepam means diazepam. Provide care in a non-judgment manner. Check the client frequently, monitor vital sign, neurological sign, and provide one-to-one supervision. Provide a quiet, non-stimuli environment, encouraging family member to stay with the client to minimize the anxiety. Orient frequently. Explain all treatment and procedure in a quiet and simple manner. Initiate seizure precursor. Assist to administer sedations and anticonvulsant medication, right, as prescribed. I said benzodiazepam or diazepam is a drug of choice. Anticonvulsant beta blocker like atenolol can work. Supplementations with a thiamine or folate multivitamin to prevent Wernicke encephalopathy. Also monitor intake and output. Assist administer vitamin, multivitamin, vitamin B complex, including thiamine and vitamin C. So supplementation with thiamine, folate, multivitamin can prevent degeneration of brain disorder we call Wernicke encephalopathy. Assist the client with activity of daily living. Assist with ambulation if stable. Allowed to express the fear. So medication therapy for alcohol abuse. So here, medication is prescribed only for those individuals who have stopped the drinking. It is called naloxone. Work by blocking the brain. The high feeling that people experience when they drink alcohol. So now we are going to talk what are the nursing care. And also, we already discussed it. I said, let me recap a little bit. Nursing care for withdrawal, assess the patient risks and withdrawal severities using a scanning tools. Initiate the cardiac monitoring. Ask the client the time of their last drink. Provide a quiet environment. Ensure patient safety. Assist with ambulation. Also implement seizure precursor, right? Like a padded side rail. So next go medication therapy for alcohol abuse and alcohol dependency. So what is dependency? As I told you, physical dependency bodily required the substance to avoid the physical symptom of withdrawal. And psychological dependency means absence of substance result in significant anxiety or distress, right? So first of all, here we can say it is called a compro state, a compensate, work by reducing the physical distress and emotional discomfort people usually experience when they are quite drinking. Disulfiram work by causing a severe adverse reaction when someone taking medication consume alcohol, right? So not these two together can cause a big problem. Next, disulfur therapy. The client must abstain from alcohol for at least 12 hours before initial dose of administered. So if your patient take disulfiram, make sure your patient never ever take alcohol at least 12 hours. Adverse effect usually begin within several minutes to 30 minutes after consuming alcohol and mainly last 30 minutes to 2 hours. Alcohol consumption is avoided for up to 14 days after disulfiram therapy has been discontinued because it placed the client at the risk for disulfiram alcohol reaction. Now here we can say what are the disulfiram therapy adverse reaction? Sometimes facial flushing, sweating, throbbing headache, neck pain, nausea, vomiting, hypotension, tachycardia, respiratory distress. Disulfiram therapy, client education. So inform the client about the effect of medication, ensure the client agreed to abstain from alcohol. Inform the client that the effect of medication may occur for several days after discontinue. So dealing with the client who abuse alcohol. So inform the client who is on disulfiram therapy to avoid the use of substances that contain alcohol, such as cough medicine, rubbing compound, vinegar, mouthwash, right? The client need to read label of all product. So dealing with the client who abuse alcohol. Next, direct client focus to the substance abuse problem, identify situation, and set limit on manipulative behavior and verbal and physical abuse. Hold the client firmly to reasonable limit and constantly reinforcing rules with reasonable consequence for breaking rules. Hold the client accountable for all behavior. Assist the client to explore the strength and weakness, and should the client to focus on strength if the client is losing control. And should the client to participate the group therapy and support group. Now, therapy for the client with substance abuse and for their families. Behavioral therapy, hospitalizations, and some kind of psychotherapy might be individual group, or family therapy can work. So we can provide the referral to peer support groups like alcohol anonymous group or courage cognitive behavioral therapy to improve the coping skill and stress management. This is important. Alcohol withdrawal, alcohol abuse, and addiction for NCLEX board exam.